Healthcare Sunday on 104.7 KJUL, sponsored by True Care Treatment Centers. In for Warren Zeisman this month, your host, Joanna O'Neill.
Good morning and welcome to Healthcare Sunday on 104.7 KJUL, the jewel of our valley. I am your host, Joanna O'Neill, and I am really excited and honored today, as this week we have a wonderful guest for you, LeeAnn Mandarino, from the Cleveland Clinic Ruvo Center for Brain Health. LeeAnn Mandarino graduated from UNLV with a Master's of Arts in Political Science. She is currently the program manager at the Cleveland Clinic Ruvo Center for Brain Health. She has been with the center since July of 2007. LeeAnn has extensive experience in community outreach, health promotion, and education. LeeAnn is an experienced conference organizer, having implemented scores of local, regional, national, and international CME conferences in scientific and public policy think tanks, several of which have positively impacted both national and state policy. In 2016, LeeAnn and a small group of community stakeholders initiated the Dementia Friendly Nevada campaign in Southern Nevada, a community-wide initiative to create an accommodating and responsive society for individuals with dementia and their caregivers. Welcome, LeeAnn, to Healthcare Sunday. We are so excited and honored to have you here with us today.
Thank you for having me.
LeeAnn, I know that you've been with the organization for quite some time now. What was it about the Ruvo Center that initially drew you in?
I was interested in working, first of all, with the man that hired me. His name is Zavin Kachatourian, and he was the director for the National Institute of Aging and the National Institutes of Health. He had a very long track record of promoting research and education for Alzheimer's disease and related dementias. Back in the 70s, he was the one that was knocking on the senators' doors in the House of Representatives to get funding for research, and there was none back then. In fact, Alzheimer's disease was a relatively unknown disease, and people just thought as you grew older, you got senile, and that is just the way it was.
Right.
And his argument was, no, Alzheimer's disease is a disease, and you could grow to be 100 years old and have wonderful memories, or you could be 50 years old and have full-blown cognitive dysfunction because of dementia. My mother is 90 years old today, and
congratulations.
she
That's wonderful.
is completely intact with her faculties, a very active woman. And if I could have a wish for all seniors in the world, it would be to be able to age like she did in a healthy and productive way. And she's a very happy woman today. And as her family, who would be her caregivers if she wasn't, it would be a much different story today. So this is something that drives me.
Wonderful. I mean, I can tell your passion is there. You've been with them for, again, it's been 12 years or so, right?
12 years, yes.
12 years. That's fantastic. So what conditions or diseases do you treat at the Ruvo Center?
We treat progressive neurodegenerative brain diseases, Alzheimer's disease and related dementia. So those dementias would be Lewy body dementia, which is also considered Parkinson-type dementia. It presents completely differently than Alzheimer's disease. Another one is frontotemporal dementia. That affects people in their 50s and up, and it's a pretty quickly progressing disease. Most diagnosis is usually occurs when they get in trouble, because nobody would think a 50-year-old or a 55-year-old would have dementia. They just look at it as a criminal type of behavior, but their executive ability is degenerating, and so they can no longer they can no longer control their executive function between right and wrong and things like that.
And when you say they get in trouble, so do you start noticing a decline in work, like in their
Yes,
work
absolutely.
environment?
Many of them usually get fired from their jobs. They take on compulsive behaviors, and this is the prime of their lives, and so they lose their families. They end up on the streets oftentimes. It's a pretty negative demise. Other diseases we treat are Parkinson's disease and related movement disorders, which is also a very awful disease, and MS, multiple sclerosis.
And then what sort of programming is offered at the Ruvo Center to manage some of these conditions that you're talking about?
We are a very holistic center. We treat the whole person with the disease. We do clinical work where we diagnose and we treat. We have imaging, so they could get their imaging done right there and then. We have physical therapy, occupational therapy, music therapy. We have social services, and we have education.
Oh, wonderful.
Yeah.
So it sounds like you work with a very multidisciplinary team.
Yes, and I forgot to mention we have a very vibrant research team too, because this is a progressive disease. We really have to find cures for this.
Oh, absolutely.
Yeah, so we do research on Alzheimer's and dementia and movement disorders and MS.
Oh, wonderful. And what are some of the more exciting programs that you're currently working on?
Myself, I am in charge of the education department, and so our department does education, advocacy, and outreach. Our goal is to create awareness throughout the community on what these diseases are and how to manage, in case there's an interaction, how to manage these types of diseases, how to get earlier diagnosis. Very important for the long-term outcomes for a patient and the family. And so we have really 4 components of this department. One is K through 12. So we'll go out to schools and we teach students about the brain and try to get them excited about neuroscience. We are working on a new project, which is a brain health project, teaching kids, in elementary through high school, how to take care of their brains. Mm-hmm. It really starts then. Yeah. A lot of kids are bike riders, skateboarders, football players, soccer players.
A lot of brain injuries.
And so this is a way to teach them to respect their brain and learn how to prevent those accidents that would result in a concussion that we don't know what it does in the long term regarding their brain health down the road. As we're finding out with football and NFL, there's something called chronic traumatic encephalopathy that is a result of brain injury and bad outcomes for those folks that get it. We don't know. I mean, not every football player gets it, but there is some causative factors that cause some people to get CTE, which is a pretty bad brain disease.
I recently read an article that was published that had to do with boxers, I believe, in martial arts too, or was
martial arts, all sort of professional fighting in the state of Nevada. All professional fighters, Muay Thai, the professional fighters that do the MMA. Yeah, thank you, and boxing. They all have to go to get an MRI here in the state. And a lot of these are pretty amateur fighters, and so we got a grant, and they can come into our clinic and get a baseline assessment, neurological, cognitive, and we give them an MRI. So we could look at their brain, create that baseline, and they promised to come and see us every year afterward, so we could see in real time what's happening to their brain as they're getting the hits to the brain.
Oh, that's a wonderful service that you're offering.
Yes.
There.
So, and there's been some studies and some publications out about that.
Wonderful. Now, I know that you mentioned your focus is on community outreach.
Yes.
What is the message that you would like to bring to the community when it comes to neurocognitive disorders?
Well, they're in larger numbers than we think. A lot of them go without diagnosis. When they are diagnosed, it's often, late in the game, and they're sort of lost. They don't, somebody that has Alzheimer's disease, for instance, in their mid-stages, have problems with activities of daily living. They may get lost. They may, not know how to toilet themselves. They may leave the stove on. And so there are ways to help. So that person will need a caregiver 24/7.
Right.
Or they could go to a nursing home, which is very expensive. So a lot of caregivers, family members, become their caregivers. And it becomes very stressful to take care of somebody that has this type of cognitive dysfunction. And what happens to the caregiver is oftentimes they have to quit work. So what's going to happen with their future? I mean, it becomes a very tenuous situation, not only for the patient and the caregiver, but for the community as a whole.
Right.
And so we want to let physicians know how to diagnose, what symptoms to look at early on. So we give CME courses there. We do some remote CME courses, and we do live CME courses, which really trains the professional on how to diagnose earlier. And then after that diagnosis, we don't want them to just go home for 6 months to a year and then just wait it out. We want them to seek out resources. We need them to, seek out social work, get a counselor that will help them work through the issues that they're going to face as they go through this disease, particularly the caregiver. We need to let them know that there are ways for them to get respite services and apply for grants to get money. So somebody could come to the home, or they could take their loved one to adult daycare or to another activity, and they could go shopping or get their hair done. It gets to be a dicey disease, and there are services out there that could help somebody get through this with relative ease. The knowledge is power, and our goal is to put that knowledge and awareness out in the community. When we started Dementia Friendly Nevada, we did a poll throughout the community, and the primary finding was people didn't think that there were affordable services for them to access, including health care and other social services. And the fact is, there are those services in the community. They just don't know about it. And so we went out on a mission to make people more aware of the services that are out there. So we do health fairs, and we try to connect people through Nevada 211 and Nevada Care Connection through the Aging and Disability Services Division. All you have to do is call 211 and say, listen, I am desperate for some relief. I need to do this, this, and this. And then they'll probably connect you with the Nevada Care Services, and then they'll assess what needs you have, and then you'll be hooked up. And it finds that people that get that counseling and that help through the course of caregiving, the loved one gets to stay at home years longer than if they didn't get that sort of help. So not only is it good for the patient, it's good for the caregiver, and it's good for society.
Absolutely.
Yeah.
Absolutely. That's why we're so fortunate, to have people like you out there in the community, people who are advocating, right? People who are educating, and really educating a lot of our providers out there who are going to be treating these patients.
Exactly,
right?
exactly. And another group that we educate are people that are getting training in healthcare, because, a lot of physicians, they're not neurologists, and even neurologists don't get a whole lot of time spent studying dementia type diseases. And then you get a primary care physician that they're just so busy that they don't have time to keep up with the latest treatments and the latest diagnostic procedures. And so we try to give that to them in an 8-hour period or a 6-hour period or a 2-hour period, using the expertise that our physicians go out and learn and read about and then transfer it to them.
That's wonderful.
Yeah.
And then, so you also mentioned this, and I've heard that you incorporate some experiential modalities, including music and art therapy at the Ruvo Center for Brain Health. Tell me more about that.
Well, we do. We have music therapy. We're working on our art therapy programs, but we do currently have music therapy. And it's found that, music brings people back to a time where their memories weren't affected. Mm-hmm. It brings them back to happier times. It helps them retrieve memories that they may have forgotten. Mm-hmm. With Alzheimer's disease, for instance, you have long-term memory, but your short-term memory is affected. So by having music therapy and maybe playing Frank Sinatra or the people back in the day, you could help them relive some of their happy moments. And then, sometimes we, have the caregiver there at the same time, and they're able to relate again on a more personal level that as a caregiver you don't get to do often with an Alzheimer's disease patient, because you become their carer and not their wife or husband or son or daughter. And so that's that, and so they find that music therapy really is able to help people retrieve lost and happy memories. We also do the learning arts, where we take people to a place throughout the world, and the patient and the caregiver are able to come together. And, a lot of times a caregiver won't leave the house with their loved one because they don't know, the actions of somebody with dementia could be unpredictable. Sure. This is a safe place for them to come.
So what sort of places are these?
So the Metropolitan Museum of Art, for instance, and they'll go through an epoch of art. And they'll talk about, say, Rembrandt or something like that. And what does this remind you of? It reminds me of a vacation I took with my husband. And it really just gets them talking and in a safe place where they don't have to worry about somebody not acting correctly. We have Conversations to Remember, where it is focused around art. And then we do the same thing. We take an epoch of art, and then we just have a theme around it, and we just encourage people to talk about it. We have a memory care respite program that where and a support group at the same time. It's really important because oftentimes the support group's for the caregivers, and they're able to work out some of the issues they're having, the sadness, depression, stress, with other caregivers. And they network, and they feed off each other and help each other. But a lot of them cannot go to a support group because they have a loved one at home. Well, we do this respite group where the patient goes to this group, and then the caregiver can go to the support group.
Oh, that's wonderful.
And we do something called time slips, where we create a story in real time. And so they'll start, narrative, So what does this picture remind you of? And I'll show a picture maybe of a dance hall in the 50s, and they'll say, oh, it looks like the prom. Okay, so what are they doing at the prom? And the patients will just start blurting out all these statements, which are sometimes really off the wall, but fun and funny, and it really engages the patient. And the caregiver will often say that, when they come home, their behaviors, they're calmer, they're not having some of the issues that they had before, because there's agitation, there's anxiety, there's lethargy, there's all different types of behaviors with dementia, and you never know what you're going to get sometimes. And then finally, we do every Wednesday from 12 to 1 at the Cleveland Clinic. We do a lunch and learn, and we have experts both within the Ruvo Center and throughout the community come and talk to people free of charge. You could just come, bring your lunch, and they'll talk about the disease, or they'll talk about physical therapy, or they'll talk about diet, Medicare issues, hospice issues, end-of-life issues. It's just a way to have that open conversation that are sometimes uncomfortable, but people really need to have, because once you do talk about these types of things, I think it helps. It helps deal with the issues that you're facing. Right. A lot of people are not comfortable with talking about those issues, and we sort of give them a safe place to do that.
Oh. So wonderful. You know, we know that, and we kind of touched base upon this, but many American families care for an adult with a cognitive impairment, right? So we also know that many of these family members and friends don't consider such care as caregiving, but it's rather something that they're just doing organically. It comes naturally to them, right? They just see that they're taking care of somebody that they love. However, I can only imagine that over time, right, this must take a toll on the caregiver, both, emotionally, physically, and even financially. Can you speak a little bit more about that? Just some of the emotional toll, the financial, and the physical toll that this can take?
Well, financially, like I said, a lot of them, if they're younger and they're still working, they have to quit their jobs because it's a 24/7 job, unless you put them in adult daycare or a nursing home. Nursing homes are expensive, starting at like $5,000 a month. Who's got that kind of money laying around? So they'll stay and they'll take care of their loved one at home, and they basically have to adjust to a whole new way of life. And just getting out of the house becomes cumbersome. We have one caregiver who describes how he would go to a restaurant and if his wife, who had mid-stage Alzheimer's disease, had to go to the bathroom, he had a problem with that because she needed help, and it's women and men.
Right.
Okay, so who is aware, what business owners are aware that this is a problem? They're not. So he suggested having family restrooms in more businesses so he could care for his wife if she had to go to the bathroom. And then he would order for his wife because she at this point was unable to do that. And got looks like, why can't she order for herself? And would talk to her, and she was incapable of doing this. And it's no fault of the waiters or waitresses or the people that are interacting with them because they don't understand. So that's another thing we do through our Dementia Friendly Nevada program is we do community awareness training. And we go out to businesses, faith-based organizations, and most recently, McCarran International Airport.
Okay.
And we're training the employees on what to look for of certain behaviors that people may have and how to help them, particularly when people are traveling and going through TSA. It gets very confusing for, I think, a lot of us.
Right.
You got to take
All
off
of
your
us.
shoes and your belt
Yep.
and your necklaces and your computer has to go there and your purse has to go there and you're
Which
trying
line
to keep.
am I going in?
Now imagine doing all that and having your father that may wander off if he goes in front of you.
Right.
And they don't understand that, there are special needs that come with these type of people, and they look perfectly fine. You can't see your brain, so they don't know that there's a disability there. And so we're just trying to bring awareness to businesses and to other service industries that, we'd like to get down on the strip. We want to work with banks because there's the issue of financial, exploitation. And so we'd like, to get into banks to say, if, 86-year-old mom is taking out $15,000 to, give to a guy, that she met at the supermarket, that's a clue that something's amiss. Yeah. And so let's flag that. So there's, we need to reach out to utility companies. If somebody's not paying their bill and it's July and 110 out, maybe it's just because they forgot or they don't even know how to write a check anymore. There are those issues. There's a lot of people in our society that are living alone and have dementia, so they don't even have caregivers. So there's a lot of issues around this, and this is going to be one of the most prevalent diseases in the United States.
I heard that.
Yeah. And the most expensive.
Yeah. And again, so important, that awareness piece, that we talked about, and that education. So what advice do you have for caregivers for preventing caregiver burnout? What can
Go
they
to
do?
support groups. Call the Alzheimer's Association. come and join us with our Dementia Friendly Nevada group and learn about the resources that are out there. Our website is dementiafriendlynevada.org. And come to some of our meetings and see how you may want to get involved in helping and being proactive about this disease. We have a lot of caregivers that are volunteers at the center just because they liked the help that they got and now they want to pass it forward.
Wonderful.
Yeah.
LeeAnn, I just want to thank you again for being on our show and for all of the wonderful work that you do.
Thank you.
So Healthcare Sunday is sponsored by True Care Treatment Centers. If you or a loved one is suffering from mental health or substance abuse issues and need assistance, you can call the True Care 24-hour hotline at 833-203-2848 for assistance.
This has been Healthcare Sunday on 104.7 KJUL, sponsored by True Care Treatment Centers.